I chose to do my paper over MODS, or multiple organ dysfunction syndrome, which is a life-threatening condition that develops after 2 or more of your organ systems will begin to fail, usually following a severe illness or injury. Most commonly, MODS is seen as a complication of sepsis or septic shock, but you can develop MODS after major trauma, burns, pancreatitis, or prolonged hypotension. In MODS, the underlying issue is that your inflammatory response becomes dysregulated. So normally, inflammation in your body will help you to fight infection or repair whatever injury you've sustained. However, when you have MODS, inflammatory mediators like cytokines are released in excessive amounts and they spread throughout the whole body. That widespread inflammation damages your endothelium, it increases capillary permeability, and it contributes to microvascular clot formation. So as a result, the oxygen delivery to your tissues will become impaired. So even when your patient with MODS blood pressure appears stable, they could still be experiencing hypoxia at the microscopic level. Over time, that can lead to mitochondrial dysfunction, meaning that your cells can no longer effectively use oxygen to produce energy. And when your cells can't produce energy, your organs start to fail. The lungs are often the first organ affected, and it frequently progresses to ARDS, or acute respiratory distress syndrome, and it requires mechanical ventilation. Cardiovascular instability may follow, including persistent hypotension, and usually requires multiple vasopressors. Renal failure is common with MODS patients and may require CRRT, or continuous renal replacement therapy, which is a continuous dialysis. And then if the patient's not intubated, they may have neurologic changes like confusion or decreased level of consciousness. You also have the hematologic complications like thrombocytopenia or DSC. MODS can be particularly dangerous because the failure of one organ system increases the stress on all of your other systems, which creates like a self-perpetuating cycle of worsening inflammation and impaired perfusion. Mortality increases significantly with each additional organ system that starts to fail. So the management for this patient focuses on aggressively treating the underlying cause, such as infection control and sepsis, while simultaneously providing support for all of your other failing organs. In the ICU, this will include close hemodynamic monitoring, ventilator support, vasopressor titration, strict I's and O's, and frequent laboratory trending.